Welcome to Module 9, Setting a Quit Date and Use of Medications. I'm Dr. Nicholas Pennings, and this is the Nicotine Cessation Training Program. So we're going to start with talking about setting a quit date. And quit dates are important because they enhance the commitment to quitting. This is important that they pick a good day to do this, that they avoid times of high stress, that is going to decrease their chances of success. And in general, I like people to set a quit date about 2 weeks into the future. And what that does is that gives them some time to prepare and also a chance to start weaning, which I'll talk a little bit more about. A quit date can be a special date, especially if one is coming up, a birthday. I tell people to think about quitting smoking as a gift to themselves, and that puts it into a positive light. New Year's Day is a common day for people to look to quit smoking. Valentine's Day is another one, as well as Lent. 4th of July is a Independence Day and a way of thinking of becoming independent of smoking. A vacation can be a good time to quit smoking, particularly if they find that they're going to be relaxing. And the Great American Smokeout occurs on the third Thursday in November every year, and that is a day to consider quitting smoking. You want people to prepare for their quit date, and you do that by preparing their environment. To help create the right environment, you want to remove nicotine products from the living area, getting rid of ashtrays and lighters and hookahs and any other paraphernalia that's associated with tobacco or nicotine use. You want to have their teeth cleaned. That often creates a good feeling in the mouth and less of a desire to put smoke in there. Cleaning out the car, even having it detailed to get rid of that smoky smell. Remove any kind of triggers that people might have, and as well as getting rid of tobacco advertising. The tobacco companies are very good at giving out belt buckles or shirts or t-shirts or different items that promote their advertising. And lastly, you want smokers or other tobacco users to have healthy food choices available to them, so that if they do feel a need to snack, that they've got healthy choices. So let's now move on to some quitting strategies, and there's many different types of quitting strategies that can occur, that can be used. Cold turkey is probably one of the most common ones, which really just means quitting and not doing anything, just picking a day and just stopping in that day. And people do that. They can succeed, but it really takes a high level of commitment, a high level of motivation to be able to succeed with a cold turkey strategy. There's another strategy that I refer to as the smart wean. Many times people will wean down on their cigarettes before quitting smoking, but what I've found in the past is that many people wean down to what I call their favorite cigarettes. It might be the 3 or 4 cigarettes during the day that they would miss the most when they quit smoking, and they often wean down to those. And what I find is a smart weaning strategy is actually to wean off the favorite cigarettes first. Identify the 3 or 4 or so times that people smoke, that they would crave a cigarette the most, or create a nicotine product or tobacco product the most, and that might be after a meal or with a cup of coffee or with alcohol. Different situations that trigger the desire to use tobacco. If they start weaning away from those situations first, they're much more likely to succeed. So I tell them, wait 10 minutes, wait 20 minutes, wait 30 minutes after a meal, and get used to not smoking in that time. And that's a good way of preparing for quitting smoking, because when their quit day comes and they say have a meal, they're already used to not smoking at that time, and that makes it easier to navigate those challenging moments. There's plenty of support that's given by different programs out there. There are many online programs that you can find them at smokefree.gov, but also there's an 800 number, and this is a national number, 1-800-QUIT-NOW. That is a national number of people that people can call, and what it is it's tied to area code. So if you call from a North Carolina area code 910, it is channeled to the North Carolina QUIT program. And and so you're connected with the people in that location. Now, what's complicating that matter a little bit now is that many people move from one area code to another, and they maintain their cell phones. So if you call on a cell phone from, say, the state of Ohio, that has an Ohio area code number, you'll be connected with the Ohio quit program, which may be different than the North Carolina or other state programs. Some strategies to quit smoking include nicotine replacement. Nicotine replacement is now available over the counter. It's available as a gum or a lozenge and as a patch. It also can be provided by prescription as an inhaler or a nasal spray. Bupropion is available by prescription, and varenicline, known as Chantix, is also available by prescription. So, nicotine replacement, there's a gum and a lozenge. They come in 2 and 4 milligram strengths. What's important with this nicotine replacement is that it's used properly. Many people who said that these products have not worked for them have not necessarily used it right. So if people, for example, use the gum and put it in their mouth and start chewing on it like a regular piece of gum, it's going to release all that nicotine. They're going to swallow that nicotine, and it's going to upset their stomach, make them feel nauseous, but also because it goes down in the stomach, it's broken down in the stomach, it's not absorbed, and so it does not work. They do not get nicotine into their system. The way these products work is they need to be absorbed through the cheek, through the buccal cavity. The side of the cheek is where the nicotine goes into the system. And for the gum, what you do is you put it in your mouth, you bite it a couple times till you get a peppery sensation in your mouth, and then you park it between your cheek and gum, and the nicotine then is steadily absorbed. After a while, that peppery sensation resolves, and you bring it back down, bite it a couple more times, and put it back. And keep going back and forth, allowing that nicotine to be absorbed through the cheek and continuously releasing it. The gum likewise is also parked in the mouth and allows the nicotine to be absorbed through the cheek. The gum comes in, as I mentioned, 2 and 4 milligram strengths. The dose is based on the first morning cigarette. If they smoke their first cigarette in less than 30 minutes, they should use the 4 milligram strength. If they wait more than 30 minutes, then they should use the 2 milligram strength. And one of the challenges that people have with nicotine replacement is that they don't use it often enough. They often wait until the withdrawal symptoms are strong, and it takes a while for the nicotine to be absorbed with this. So if they're having a strong craving and they're expecting a rapid nicotine release, they're not going to get it, and sometimes that frustrates the smoker a bit. So they should be used like approximately every 1 to 2 hours, at least during the first 6 weeks, and then it can be extended for longer periods of time. And generally, I like to use at least 9 a day when you're first starting on nicotine replacement. The lozenge, similarly, at 2 and 4 milligrams, the lower strength is used if you take more than 30 minutes before you have your first cigarettes, and the higher strength if it's less than 30 minutes. And patterns are similar. You want to make sure you use enough of it and use it early enough in the withdrawal process. So as I said, proper use is key. You want to make sure you use the nicotine replacement for at least 12 weeks. And I like the gum and lozenge, particularly for people who use less than a pack a day. This tends to be more effective for these individuals. The nicotine patch is another mechanism for helping to quit smoking. It comes in 3 strengths, 7, 14, and 21 milligrams. This is a patch that's placed on the skin and left on for 24 hours. Usually, the usual dose is the 21 milligram strength patch. You use this for 6 weeks, changing the location each time. You then switch to the 14 milligram patch for 2 weeks, and then the 7 milligram patch for 2 weeks. If somebody smokes less than a half a pack a day or equal to a half a pack a day, you may want to start with the 14 milligram strength and use that for a total of 12 weeks. By moving it around, you do avoid skin irritation, which is a common complaint. And some people complain of nightmares when they're getting nicotine during their sleep. And if that's the case, then they should not smoke, or they should take the patch off at bedtime. A full course of treatment is essential. Many times people stop using the nicotine replacement too early, and as a result, their risk of relapse is higher. The Nicotrol inhaler and Nicotrol nasal spray are two other forms of nicotine replacement. We don't use these very commonly, but they may be ideal for certain people who have struggled in the past. And typically, they come as a cartridge that you inhale over 20 minutes. You would use 6 to 16 a day, and a box of cartridges costs about $250 to $300, and that's going to last you usually less than a month, so it becomes quite an expensive endeavor. You typically would start weaning off the cartridges somewhere between 6 and 12 weeks. Nicotine nasal spray, what you do is you deliver a nasal spray of nicotine into each nostril. Each spray delivers about 1 milligram per dose, and you use this every 1 to 2 hours, a minimum of 16 sprays per day for the first 8 weeks. Again, using too little tends to not provide sufficient replacement to control the withdrawal process. The maximum is 10 sprays in an hour or 80 sprays in a day. A bottle costs about $75 and provides about 200 sprays, and lasts for the average person about a week unless they're using it very frequently. And so the net cost is typically around $300 a month for the nicotine nasal spray. Medications that are available for smoking cessation, bupropion has been around for some time. It was the brand name for quitting smoking was Zyban, but it's also sold as Wellbutrin for depression. You typically start at 150 milligrams a day for 3 days, and then go up to twice a day. There's once-a-day formulas that allow for daily dosing, and typically people would start the bupropion 5 to 7 days prior to their quit date, and they should take it for a full 12 weeks. One of the advantages of bupropion is that it can help minimize some weight gain, but it also can interfere with sleep, and the last dose or the second dose, if you're taking the twice-a-day dosing, should not be taken after 4 p.m. to reduce the risk of insomnia. Varenicline is the most recently approved product for smoking cessation. It's sold under the brand name Chantix, and it has a dual activity, both an agonist and an antagonist type activity. And I'll explain that in a moment. It requires titration of dose, so you start with 0.5 milligrams a day for 3 days, and then 0.5 twice a day for 3 days, then 1 milligrams twice a day, and you continue that dose for 11 weeks. Nausea and insomnia are the most common side effects associated with this medication. There is a small but serious risk of increased suicidal ideation and depression, and so that you need to be quite aware of that if somebody is on varenicline. So the dual agonist-antagonist effect comes about because the varenicline binds to the nicotine receptor in the brain, and by binding to the nicotine receptor in the brain, it blocks the action of nicotine. So in that way, it is an antagonist by blocking nicotine's effect. By the same token, it also stimulates that receptor, but only to a mild degree. So that small amount of receptor stimulation helps to reduce those withdrawal symptoms and reduce those cravings and make the quit process easier. So that is the agonist portion, by stimulating that nicotine receptor to a small degree. But as I said, less dopamine is released, and it has less of a nicotine effect. One of the exciting things that has been promoted with smoking cessation is the use of combination therapy, particularly with nicotine replacement therapy. So the patch, nicotine patch in gum or lozenge can be used in combination. Bupropion can be used in combination with a patch, or bupropion can be used in combination with a gum or lozenge. Bupropion and Chantix have not been effective as a combination agent, are not recommended. In general, we don't combine nicotine replacement and Chantix, although there was a recent publication in JAMA which suggested that there may be some benefit to this. The benefit comes about because that alpha-4 beta-2 receptor that varenicline blocks is not the only receptor that nicotine acts on. So there are other receptors in the brain that nicotine acts on. And if people are particularly sensitive to those receptor activity, they may benefit from a combination of varenicline and nicotine replacement, although that is not an FDA-approved use. I'd like to thank you very much for that. Reviews the use of medications in smoking cessation.